Morning, everyone. Please allow me to say all protocols observed. Although I need to acknowledge my minister, Minister Vaz, and MP Robinson, and ACP Mackenzie, Dr. Mackenzie, Dr. Shama Campbell, Dante. And you see, I don't want to start because I don't want to leave out everybody, but a lot of faces here are very familiar to me. Good to be back here. Of course, Mr. President, can't leave you out, sir. Thank you for the invitation again to come and address this very important initiative that we have here. So, over 3 decades, this has been going. Very, very commendable to have that sort of ability to stick to something and to really serve the community that you have set out to serve. And I need to mention that the JGRA is a member organization of the National Road Safety Council, and they always have very good attendance at our meetings, almost perfect attendance, as is the police, PSTEB. They're also a member organization, and the Island Traffic Authority. I think those are the ones. And also the ministry, MSET. So 3 decades that JGRA has been at this. And of course, we support them in all their initiatives. Obey the code, respect the road. That is what we're hearing, and that is so true. That's what we need to do. And before I kind of get in, there was one particular thing that jumped out at me that I wanted to set straight. We do not use the word crash. Thank you, Mr. T. You remember that. I mean, sorry, the word accident. Right, somebody's listening to me. And I'll tell you why. 2008, PAHO had an initiative where they wanted persons to take personal responsibility for their safety. Now, these incidents are 90% and more caused by the choices we make, so there's nothing accidental. So I'm forever going to be sort of giving that message. I remember ACP, when we started to talk about it, he was a little, he didn't go with it immediately, you know. And you know why? It was not in the law. The law still said accident. And as the law changed, I heard his wording change, ACP. So thank you for that support. One of the important things I need to speak about is that we're in the World Decade of Action for Road Safety, actually the 2nd decade. We failed miserably, I'm sorry to say, at the 1st decade. As I've mentioned before, only Trinidad really achieved the aim, which is a 50% reduction. We have a second chance at it and 5 more years to go. So to achieve a 50% reduction, there are a number of things that need to be done. But let us understand that based on when the decade started, to achieve 50% of what we had at the beginning of the decade, we have to go to 217 fatalities, Minister. 217. So we have our work cut out for us. Of course, we'd love to know we don't even have one, eh? But the reality when you work the figures, and again, when I speak about figures, I'm always thinking that it's really people we're talking about. Your brother, your sister, your neighbor, your co-worker. But for the point of our work, you know, we have to speak about the numbers because we need it to be going in a particular direction. So that's a working tool for us, the numbers, but we do not disregard the fact that we're talking about lives lost. So how are we going to achieve this? We ended with 425 deaths in 2024, which was a 14% reduction over the previous year. So we're doing good. We started the year off good, heading in the right direction. We need to know also that at the highest level, the Prime Minister is our chairman of the National Road Safety Council because of the importance of the impact on the society and the nation and our GDP and all of that. And he was actually the speaker on the global stage who announced the World Decade of Action. So we have to get with it. We have to be on board. Under the decade of action, the support systems we have is a safe systems approach. And that is speaking to having safe roads, safe vehicles, safe speeds, and an effective post-crash response. Remember in the earlier days we had the E's, the 5 E's, emergency response, education, engineering, and so. Well, it has transitioned into these headings. And so this is how we categorize the work that we do. But let us look at the current situation. To date, I didn't look at the report this morning from the police. We get that report by about by about 8 o'clock, 6 o'clock some days, right, most days, from the police, and then follows the one from the Island Traffic Authority later on in the day. So we have information on fatalities. Unfortunately, as was said, we don't have the information on injuries. We're working towards that because more persons are injured than actually die. So to date, 165 persons have died compared to 179 for the comparative period last year. So we have gone down 8%. We started off the year, as I said, 14%. We have gone down a bit because if you're following the news, you'd have noted there are a couple multiple fatalities, and that is always dangerous when one incident yields more than one death. So that is what we're seeing. When we look at the statistics, 22% are pedestrians in terms of the fatalities, 27 motorcyclists, that has come down a bit, pillion passengers 4%, pedal cyclists 6%. So if you look at those categories, and these are the categories of vulnerable road users, motorbikes are top of the list, 27%. And when you add all the categories together of vulnerable road users, is 60% of that grouping account for the 60% of the fatalities. Now, we know about the wanton disregard of the rules of the road, the speeding, the overtaking and undertaking, the way the taxis behave and the robots behave. The pedestrians too, with their ears plugged, they can't even hear what is going on. They're not even factoring in how dynamic the road environment is and how much it changes. But I maintain one thing. We are no more indisciplined than any other nation. What we have to press for is effective enforcement. And I'm sure I've said it here before, that Jamaican who takes a plane to go to Kingston 21 will all travel with a car seat. It's the same individual. So it behoves us as a nation to look at what we need to do and what we need to put in place. And actually the safe systems approach, there's a philosophy behind it. It is that everything must be put in place to ensure that when we do as humans, and we're not infallible, when we make a mistake, it doesn't cost us our life. You understand? So we have to ensure that we have everything in place. Yes, we're saying personal responsibility. We have that. We have to exercise that. We have to take personal responsibility for the choices we make. The speeding, the breaking of the red light, the cell phone use. Now that one is such a terrible one because it's like driving drunk. The only thing is when you put it down, you're not drunk no more, right? If you can understand that analogy. So we need to have and enforce the laws. And the thing is that, when things look bad, and the numbers going down, and Dr. Jones called a meeting, he turned first to the police. He said, how you can help us, ACP? Because enforcement is the other side of the equation to education. If you educate and there's no means by which people have to behave in a particular way, you're not going to get the behavior change. So enforcement is key. In 2020, the National Road Safety Council and its partners, Road Safety Unit, ITA, JCF, JAA, HART, NTA, IAJ, Insurance Association of Jamaica, we embarked on a program just after COVID. We did it about 1.5 years, I think, until the funds ran out. We were funded by the the Live Good program of the Ministry of Security. And what we did, we went out to the west. That's where the motorbikers were dying. At that time, there were 30-odd% of the fatalities. And on a Sunday, we would train a cohort. It actually took place over 2 Sundays because you cannot get them in on a Saturday. Saturday is their hustle day. But Sunday, you bring them in and you give them a meal, and they would come in and we would train them. We trained over 500 motorcyclists and handed out almost 1,000 helmets. The helmets were donated by the FIA Foundation. Now, when the funds ran out, because what I'm doing now is just talking about some of the things that are on the books that we are executing. When the funds ran out, we decided to engage HART NSTA to see if they could institutionalize motorcycle training within their operation, because they're well suited to that. Happy to report that the answer to our request is yes, and they actually have a program that they have put together, but it has to go through the whole process internally to be approved. So we're looking forward to institutionalizing training of motorcyclists. The companion activities to that at the moment is the National Helmet Wearing Coalition. That's actually chaired by Dr. Jones. And what they're about is solely getting persons to wear the helmet, cover the head. That outer shell of the vehicle is reduced to that shell over the head. That's all they have. And depending on the type of crash, it may not save them if they injure other parts of the body. But many times, if you do the research, the trajectory when there's a crash is that the motorcycle goes up and then gravity brings him down on the head and the spinal cord. So it's very important for us to get that message across. So the Helmet Coalition, a 3-year program, again financed by the FIA, is being executed. And in a couple of days' time, there is going to be a think tank, a regional think tank, June 19th, hosted by the coalition with experts from across the Caribbean and Latin America. And they will be exploring best practices and policy development around helmet safety. So that gives us an idea. And why are we doing this? There was a cost of care study published in 2017 based on 2014 data, which show the direct costs of crashes. There's one case study they did. 5.6 million was the cost, the hospital cost. And there was another 3.6 million in direct costs, rehab, medication, care, and that sort. And that was 9.2 million. Now, to go back to some of the things that the Prime Minister, our chairman, has spoken to in May 16, 2024, he instructed that several initiatives be undertaken with urgency, including a high-level public education campaign. And thank you, Minister, we heard your announcement that we're to get 5% of the ticket fines allocated to the Ministry of Security. And I think there is yes, that is worth commendation. We have been lobbying for this. So we are looking forward to executing programs with that funding. The reactivation of the demerit point system still hasn't been worked out by the ITA, and it is critical. We're looking to the ITA to solve that one with some amount of immediacy, because there are many people in the traffic environment beside you, behind you, who shouldn't be there. The use of cameras to detect road traffic infractions, critical. We are in the AI age. Come on now, Jamaica. We are in the AI age, right? When I speak to AI now, AI is addressing me as Paula. You know, the technology is moving. It has been shown that when you have electronic enforcement, it has a very positive impact on how people behave on the road, simply because you don't have to have a policeman on every corner with his speed gun. The breathalyzer program got a little benefit under the United Nations Road Safety Fund that we are executing in collaboration with the Pan American Health Organization. Under that project too, the police have gotten laser guns to support them in controlling speed, And they're also undertaking right now operational speed studies and when they do the speeding, they will also test people for alcohol, and that will provide them with information that can inform their future in interventions. The IMAP, I have Dr. Campbell here, as I mentioned. She is head of that at the ITA. It's a web-based program being implemented to digitalize crash data real time. And you know, we're already getting it early in the morning, but she will be able to, and the police will be able to, because it's the police who will be executing this particular initiative. 200 officers have already been trained, and they have gotten 115 tablets. So we're looking forward to the police being able to really crunch the data and to be able to inform their programs because they get real-time data. Emergency response has also benefited under the UN Road Safety Fund project I've been mentioning. We're also looking at the Spirit License Act. Minister, if you can help us with that, that has been taking a bit of time. I know it has reached a particular stage, but we really need to sign off on that. The current act speaks to horse and buggy, so we need to move on from that. Finally, in terms of the interventions, and Dr. Campbell is again associated with this, the IRAP program, International Road Assistance Program, that we have been trying for years to come to Jamaica. It uses a georeferencing system to collect data in the traffic environment. It's a motor vehicle equipped with cameras, and at various intervals it takes photos and it gives information that they can use to determine, you know, wrong angles on a road, bad spots, that sort of thing. So we're looking forward to that. The key now is when we get the information, we have to implement the corrective interventions. And we need to remember that that is important. We have to find the funding. And as I always say, spending on road safety is an expense already. Let us put it on the other side of the equation and make it be an investment. We perhaps won't spend any more money, but we'll get the result that we want. So that in a nutshell, I don't want to take up any much time, are some of the things that we're working on with our various partners. As I tell people, we're an advocate group, but we do facilitate the various partners in getting things done by begging funding, going to United Nations and placing ourselves where we can get things going, because money make things move. So I'm optimistic. Don't I sound a little more optimistic this year? That everything will converge, and that one day when we travel on our roads, we will feel that we're safe. Top of the list has to be electronic enforcement. Road crashes can and must be prevented. They are not inevitable. We must continue to act to reduce the spike in fatalities, destroying our people and impacting our ability to develop as a nation. So the time to act is now. Matter of fact, for some, we're too late, and for others, we're running out of time. I picked up that phrase at a conference. For some, we are too late, and for others, we're running out of time. So the time to act is now. Let us all recommit in this National Road Safety Month to do this. And as our slogan says, make road safety a way of life. Thank you.